Everyone, I'm Dr. Vishal Jain. I'm gonna discuss today about my experience working as a dentist in Canada. I understand this is a very important question in all of us mind, whoever is planning to move to Canada, whoever is thinking that what kind of a job to expect, what kind of work to expect once you become a dentist, what kind of money to expect. That's are the usual questions which I'm asked. So I'm gonna discuss most of this today based on my personal experience. Everybody's experience is different, but I've talked to a few friends and what do they go through and how it is, and I would just give you a brief idea which might help you in making up your mind or not to make up your mind. That is totally up to you. So you all know that there are two process stream you can take, which you can refer to NDEB website, how you can become a dentist in Canada. Either you can go through the equivalency process, which is the 4 exam process, or you can go to the university, which I've discussed in other videos on the channel. You can go there and you can visit them. But once you become a dentist, what do you expect? So first thing, when you start as a dentist in Canada, usually you have to register yourself once you finish your OSCE exam with any of the local government body or the dental body of that province. For example, if I'm practicing in Alberta, I would be registered with Alberta Dental College and Association. So that is the organization which gives me the final license to practice. So once you finish your OSCE, you have to acquire this license, which has a certain fees depending on which province you're registering, and then you get the license to practice. Now, when you try to find your first job, usually it is very difficult to find your first job because there's something called as Canadian experience, and usually employers are looking, or the dentist, principal dentist, or the organizations are looking for somebody who has the experience of practicing in Canada. So landing your first job is usually very tricky. It took me 3 months. Though if I tell you about my background, I did my master's in India in endodontics. I was practicing in India for almost 8 to 9 years before I did get the license to practice in Canada. I had a lot of experience, and then also it was very difficult for me to find my first job. The job which I wanted, there were jobs available, but then you have certain criteria where you want that kind of a job. But that's what it is. And if you're a fresher, things will be different. If you're an experienced person, experienced dentist from back home, it will be different. But it is usually difficult to find the first job. I've heard that people do prefer people who have done schooling in Canada, and I would kind of agree with it. It's easier for them to land a first job which is better than you, but it's not the same thing down the line once you also get your first job, which might be difficult. So the first thing which people usually ask me that how do you work, like, so you usually land up working as an associate dentist with somebody to begin with, where you are paid 40% to 45% of the work you do, and it depends on the clinic where you're practicing, what kind of a work you get. But my general experience have been like, usually most of the patient, because in Canada dentistry, a lot of people is expensive. A lot of people have dental insurance, a lot of people don't have. But people who have dental insurance, things like cleaning, fillings, endo, extractions are usually covered by the insurance. Usually you will find a lot of routine bread butter dentistry which happens through these things. So you have, if you're good in these things, you will be okay. But then if you want to go to the next level, you have to learn implants, you have to learn ortho, but you can always grow step by step. But this is the basic bread butter dentistry, which usually is consistent of 80% of the work you do. Now, uh, the other thing which people ask me, how much money do you make usually? So you can make anywhere between $10,000 to $30,000, maybe more. It all depends on the kind of work you can do, and kind of flow you have, kind of speed you have. Also, I would like to add about the previous experience you have in the field of dentistry. If you have more experience of doing clinical procedures, it gives you a comfort zone when you're practicing here. If you're a fresh graduate, have just cleared the exam, and you don't know much of the work, it's a little difficult initially, but have patience, do the courses, do the CDE courses, you will be there. But yeah, definitely if you're someone with experience back home, it helps. One big difference which I felt was dental services was just utilized by a very small fraction of the society back home. Here we see more than 47 to 75% of people, depending on different socioeconomic status, taking advantage of dental practices, taking advantage of dental services. So even the population is a little less, but the utilization of dental services is quite high. I see people are really aware. They take care of their teeth. They come in for their cleanings. They get their kids in, and they want to install in the patients right from the beginning, in the kids, that how important it is to take care of their dental health. So that's a big difference which I felt, and that's how it is. And I would love to put all these measures back home too. It will be very nice for our patients back home to learn from here. So I would also like to add about the physical stress when you're practicing dentistry here, because you have really well trained assistants out here. So you don't have to prepare anything. You have to get in, talk to the patient. The assistant takes care of rest of the thing, and they are very, very good. Some of them are really good, really well trained, experienced, and even the front desk is taken care of, usually in good practices, by office managers, and they take care of the administrative part of the practice, so you can focus on the clinical part of dentistry. And usually that, I feel, is a big difference from the way dentistry is practiced back home and dentistry is practiced out here in the Western world. And something I would like to add to you about how many hours people work. So it depends, totally depends on you. People work for 5 days, 4 days, 3 days. They work for 7 days too. Some people work for weekends as well. So it all depends on how many hours you want to give in, how many hours of work you get where you are living in Canada. So it's on that. I'm saying this because I moved from India for a better work-life balance. So I really got it here. In India, I was working for a longer time, for longer hours, for more number of days. Here, I can make a choice. I can work for 4 days, 5 days, and I make enough to live a good, peaceful life. So I think you can get a better work-life balance. The other thing I would say about work stress, the other question which was very frequently asked, that they have heard back home, there are a lot of cases. Yes, there are cases where patients can sue you, because if you are negligent, or if you're not following the protocols, or if you're not in line with the ethics. So yes, so if you are here and you are doing the right thing, you don't have to worry about all that. Other thing I would say, if at the end of it, if you love dentistry, if you've been passionate about it, you will do good anywhere in the world. Definitely, it's more paying out here in Western countries in comparison to Asian countries, but you have to work hard and get yourself established. So it's take some time, have your patience, and you'll be good. About the stress in the work, I would say any kind of work is stressful or not stressful. It depends on your personality. Uh, if you learn how to manage your stress, no problem, you can do really good. So I would conclude it by saying that your first job is difficult to get. Your English should be good. Your communication skills should be good. If you have good skills, you'll make good money. You can treat more number of patients. You can treat variety of cases. Patients are nice. People are nice everywhere in the world. I'm not comparing, but yeah. And if you are moving for a better work-life balance, this is the place. So my experience as a dentist out here, for all the dentist colleagues out there, my video will be available whenever I get time. All this I've discussed is pre-corona period. I was not getting enough time to make the videos, but now I have time. I don't know how things gonna unfold after we open up, because right now we are not working, we are at home. How it goes from there. And one thing I would say, it's my personal advice. I don't know how it will, which people ask is about saturation in Canada. I would say, yeah, there is saturation. There is saturation to find the job of your liking. You might find a job which you won't like, but to find a job, there is real stiff competition. Most of the cities are quite saturated, like Vancouver, Toronto. All these big cities are saturated. Others are getting saturated. I think there is a window of 3 to 5 years when you can get a good job and make a good life as a dentist. But it's my personal opinion. Anything can happen. I really don't know. But one thing I can tell you: if you're passionate, if you're doing good, and if you're working hard, you're training yourself, you'll be good any place, anywhere in the world. You don't have to worry about anything. All right. Best of luck, guys. Thank you for listening to me.